We don't necessarily have an agenda for today. Our goal is really just to hear from our participants. And so I want to open us up by saying, by just asking the question, how has the coronavirus or the COVID-19 pandemic impacted you? We want to just make sure that we are hearing from people. We want to know, how you're feeling, if you're able to get groceries, if you're feeling lonely or isolated, if you have questions about accessing telemedicine or questions about staffing, questions about or comments about staying safe, or issues with your group home, issues with special education services. And so it's really just an open forum for people to tell us how they're being impacted or what you're experiencing.
It's kind of hard for me as a disability person. I'm a peer mentor. I'm getting trained and everything, and we had to postpone me and my friend's training, which this is Laura.
Hello.
We live together, and we've been hanging out lately. We've been washing our hands, taking more showers and all that stuff, but it impacts us because we're so used to ripping and running. Mm-hmm. We're not used to staying home and not doing nothing. But I've learned that this COVID-19 is so serious that I don't even go for walks half of the time. I stay home. And if I do go for walks, I come home and I immediately take showers. I'll take 3 or 4 showers a day if I had to.
How are you feeling about having to be home so much?
My anxiety kicks in. I have to mainly stay with my roommate, my sister, just for my depression, anxiety don't kick in because we're in 4x4s, so we can't really do nothing.
Okay. Thank you for sharing.
You're welcome.
Someone is asking, where's the raised hand button located?
Hi, everyone. The raise hand button, if you click on participants at the bottom of your Zoom window, should open a panel on the side, and there's a raise hand button in there if you would like to raise your hand and unmute, or if you would like to just unmute and ask your question or add your comment, you can do that too. But please remember to be respectful of other people talking as well, so we can try to get to everyone. Thank you.
Sorry, go ahead.
No, go ahead.
I'd like to comment. So as a service provider, I'm a licensed master's level social worker, and I work for a local Center for Independent Living. And I know as a person with a disability, I've had to really shift how it is that I'm providing support to respond to COVID-19. As a person with a disability, it's challenging for me to provide support in a virtual format, but also really, at the same time, really focusing on making sure that people are safe and taking care of those basic unmet needs. So I would say that it's been a shift for sure.
Thank you for sharing.
We do have a comment on Facebook as well. And that comment is, I am the mom of a young adult on the autism spectrum. Her basic needs are being met, but she struggled with loneliness, unwanted social isolation, and cabin fever before COVID-19 crisis. So the stay-at-home order has been challenging for her mental, emotional health.
And we have some comments from Zoom. Kalila says, so far the impact is minimal. I actually am enjoying the extended break, but my adult son with autism is starting to miss his friends somewhat. And then we have from Noah Walker, so far I've adjusted, but I'm currently at my parents' house near Ypsilanti, and I'm not comfortable with reopening the economy until there's a vaccine that actually works. And then we have from Sandra Kernan, and she's asking, does anyone have any info about adding COVID-19 payments for caregivers of adult dependents since they were left out?
I don't believe, I think right now, we were on a call, some of our DD Council staff was on a call yesterday, and at this time, the current bill that is being, that is moving up doesn't include that, but we were assured that the disability advocates in Washington, D.C. are still fighting for a fix for that. And if you go to the Social Security Administration website, there is more information about that. But at this time, there isn't a fix for that.
I'm concerned about my son, that he's 33 years old and he has CLS, but he's also very immune suppressed and has had numerous, too often to mention, bouts with pneumonia. And I just don't think he's ever going to be able to go out again until there's a vaccine, which could be 18 months.
How are you all coping with that?
It's hard. It's hard. I mean, we're trying our best, but I don't know. I mean, does anybody else have any input about if they're going to let their children or someone with a disability go out again?
Well, we've got almost 100 people on, Mary, so we'll see if someone else has any response.
Can you hear me?
Sorry.
Hello? Can you guys hear me?
Yes.
Go ahead, Tori.
Okay. So I work for Lifespan. I don't know how many of you are familiar with Lifespan or are not. We're out of Jackson. I am actually the respite house manager. So I know for you parents, guardians that aren't getting services right now, this is a very crucial and extremely difficult time. On our end, we're still kind of waiting in limbo to see on the 1st to how we're going to continue with services. I know that CLS is also working on how they can reach out and help any of our people that are struggling right now. We do have some staff in our company that are actually calling and doing like weekly check-ins to make sure that you guys have, you know, food, toilet paper, the necessities. One of my coworkers has even taken it upon herself to do drop-offs like puzzles or Play-Doh, stuff to keep minds busy. And she's just going, you know, door to door and dropping off. I'm not sure where everyone is from, but the people that are caring for our people, we are trying to come up with ideas and things that we can do to help you guys because we know that it is a crazy struggle. My home actually services usually like 55 people on a weekly basis, and we are down to 3. We have 2 that come every day because there's nothing else for them. They don't have school right now. They don't have the ABA therapy, no CLS. So I want you guys to know that you're not in this alone. I know sometimes it feels like it, and right now we all are quarantined. But there are other people out there that are fighting the same battle. I'm willing to help in any possible way that I can, even if it's to talk to you guys on the phone or to do like a Zoom meeting. Anything that would help any of you to get through this, and especially being stuck at home, or if you guys need ideas, I'm very open to helping and helping you guys figure that out.
Thank you.
along with Tori's comment, I just wanted to say as well, I'm from the Ann Arbor CIL, and we provide support services to Washtenaw, Livingston, and Monroe counties. And there are also CILs across the state that are providing services, even though their office buildings are physically closed. We can provide that one-to-one support to families via phone, email, and video conferencing, as well as we're offering some regular virtual programming as people are available to participate, to offer some peer support and some activities to keep people busy. So feel free to reach out.
Thank you.
I have a question. I work for a nonprofit, and I work with IDD adults and out of Wayne County, and we are still essential workers. So we do get to go into our office a couple days a week, and I work with the direct hires. A lot of the parents or the guardians or the POAs are very worried because of after this happens, they're afraid their direct care workers are not going to come back.
Right.
Because of being on unemployment for the next, they get 6 months and they're getting really a lot more than what they are. Is there going to be like some kind of provision once they're allowed, the stay at home goes away, that they're not going to be able to get the unemployment? I mean, a lot of the parents are calling me and just saying they're frantic because they're not going to be able to have anybody come to work for them that already has worked for them, because they're making a lot more money than they were making. I'm not sure who I would ask that about. Or
I'm not sure as far as all the other companies. I know our company had a pretty big layoff. My part of the company is one of the only ones that's still up and running right now because we are a crisis prevention center. Mm-hmm. But I do know that our company, we are doing everything in our power actually to try and get majority of our staff back. So how I was saying that we are reaching out to parents and calling and, you know, doing Zoom meetings, that's part of bringing part of the staff back. I know they just had a meeting yesterday and coming up with some ideas of what else they could do to come back. So a lot of our staff are eager to come back, even though they are making a lot on unemployment. A lot of them are like you guys. They're at home. They're stir crazy. A lot of them have kids. I have kids. We're ready to be back and get back to work and help you guys. And we know that you guys are struggling. One really good thing about our company is we love what we do. So we're missing that a lot right now. So we miss our people and who we work with and reaching out and helping them on a daily basis so much. Like it literally feels like you're missing part of yourself. So as far as people coming back to work, as far as our company, I really don't feel that you guys will have to worry about that.
Okay, thank you. I just, we have 180 direct care workers, and probably 60 are only left working and helping. The others are on layoffs because of the COVID virus. And a lot of the parents, like I said, are just worried that when they call them, they're like, well, we might stay home for the 4 months. And some of them work for 2 or 3 people, and I believe they're getting paid for 2 or 3 people the extra money. So I think they're looking at it in that instance. So that's where I was really worried about getting all these people back to work to help our, individuals that need the help. And I am in contact with them every day, but it's still, all I can say to them is hopefully they come back.
Yeah, no, I completely understand. I don't think that'll be as much of an issue as you think it'll be. And I can't speak for everyone, but I know with our company, our CEO is literally on a daily basis busting her butt, trying to figure out how we can bring our staff back, what we can do to help our staff that are struggling, and also help the parents that are struggling right now because they don't have any of the services. So we are completely aware of that. And that's why I said, please, please feel free to reach out, you guys. I literally will help in any way that I possibly can. And if I can't, I will reach out and find you help somewhere else.
Tedra, we have a couple hands up.
Okay.
Catherine Grant has a question. Catherine, go ahead. You're unmuted.
Hey, thank you, Tedra, for doing this Zoom. It's a wonderful way to stay connected. I actually want to comment about employees and whether or not they're going to be there when the COVID situation becomes more manageable. I believe they will be. I believe we will have an opportunity when the economy dampens, our nonprofits do better, because we won't have the competition with some of the other companies that aren't doing as well right now. So I think that the most important thing is to engage them on a regular basis. We make calls to every one of our staff once a week just to check in. How are you doing? Are you ready to come back? How are you doing with the COVID virus? Just making sure you're building that rapport and maintaining that rapport. And then the Michigan Department of Health and Human Services did send around a link where we can go and post our job openings, and they are moving people to that website when they're looking for work. So I would just say, hang in there. I think that it will be a better day at some point for us, for nonprofits, for people with disabilities, to really get quality people to provide community living support services. So thank you.
So thank you. And what we're going to, I can see that we've got a lot of activity in the chat. So we're going to take the next couple of raised hands, Mike, and then we'll go to Patty for the chat questions and comments.
All right, the next question was from Carolyn. Carolyn, go ahead. You're unmuted.
Okay, hi everyone. Again, my name is Carolyn, and I am a behavior analyst supervisor for Network 180, which is the Kent County Community Mental Health Authority in Grand Rapids. And if you haven't already, Autism Alliance of Michigan has a great newsletter that they're putting out right now. My staff have submitted a lot of articles to them about various leisure activities for families with individuals with disabilities, proactive strategies like how to make a schedule to help keep the routines up in the home, how to provide good praise, and how to help people with disabilities right now sort of adapt to the crazy circumstances that we're under. So their newsletter, I've looked at it briefly. It's got a lot of great articles. I believe it's a free newsletter. Again, Autism Alliance of Michigan, if you go right to their website. So that's a resource for families, but I can just speak on behalf. We are definitely seeing increased rates of depression, increased rates of anxiety, increased rates of med non-compliance. So we're definitely seeing some detrimental effects on the individuals we serve from this. So thank you.
We have one more question from Jan. Jan, go ahead. You're unmuted.
Thank you. So I'm very curious. I'm Jan Lampman, and right now, one of the things I'm doing is working with a group of people that are trying to make sure that people with disabilities have equal access to medical care, particularly if they end up in a hospital because of COVID-19. So I'm curious to know from the people that are on the call who experience disability or have a disability, what if you've had any experience yet with trying to go to an emergency room or see your doctor, or what your biggest worries and concerns are about medical care. I know that's a huge question, and maybe this isn't necessarily the only place that I might get this answer, but I'm just curious.
That's a good question, Jan. Thank you.
The other Carolyn, if you want to ask your question, go ahead and unmute yourself if you can.
Hi, the question that I have is, our son has a habilitation supports waiver, and during all this, his iPad, that Medicaid had provided initially is no longer working. So he cannot access his telemedicine and things that he would do routinely on a daily basis with his iPad. We've been unable to get any assistance from any agency in the state. So if anybody has a suggestion of who to call, I'd really appreciate it because it is limiting his access to healthcare at this point. And his supports coordinator did put through a request via goods and services, but it's been over a month. So, and we've, like I said, I've called every agency, Michigan Protection Advocacy, all the agencies for advocacy, and really nobody has been able to assist us. So if anybody has a resource that they can think of, I'd appreciate it. Thank you.
Have you tried to contact your local, maybe Kiwanis Lions Club service agency in the area? They might be able to help with that.
The thing that we're trying to do is ensure that he gets what Medicaid should be provided. I know that we could probably, we as his parents, I could go out and buy him an iPad in this sense, but it's about, he was provided it initially from Medicaid. What we probably will do is end up doing that because we're getting, no response. But we would like to ensure that something like this is just systematic delivery denial in a sense, be realized as almost like healthcare rationing or not having appropriate response. Do you know what I'm saying? It's not so much, is the money available even though he wouldn't have it? And for us, it would be a cost. It's about individuals with disabilities and needs being realized and then responding in a correct way. It shouldn't be so difficult, right? If it's something that they had provided before to do a replacement, especially now. And I know that we can't just go to an Apple store and buy one either. So it has been, and I'm putting it out there because one of our concerns is rationing of healthcare accessibility during this time, because we have seen that in a sense. I know several people that have tried to get testing that have disabilities. A couple of people require an ambulance to assist them to the hospital. The hospitals have refused to test the individuals. So that's the kind of thing that we're seeing out there. And I'm bringing it up because I do think that it's important because these are, civil rights issues. These are ADA concerns. And if we're not even getting a call back, I mean, that's kind of frustrating for us. I've spent several days on the phone trying to get somebody to listen on this.
We have one more question from Kara. Tedra, I'm sorry, go ahead.
No, I was going to say thank you, Carolyn. Let's go to the next question and then go to Patty. I can see the chat is really, really lively.
Kara, go ahead and add your question if you would.
Okay. Hi, my name is Kara and I work for Intentional Communities of Washtenaw. I'm sorry, I'm using the chat incorrectly. I've sent this 3 times now and I'm sorry, I go to hit enter and I send it and I didn't mean to, but what I'm trying to send you is a form that was developed by Dr. Michelle Baller at Stony Brook University. And the idea is it's a fillable form. She has one on her website for every state in the country. And I sent you the form for Michigan's, and it's to complete ahead of time when you have time to think through all of the steps in case your loved one needs to go to an emergency room. So it's just a precautionary measure that you can fill out the form so that you have all your paperwork in place in case you do. Hopefully you won't need to, but if you need to take your loved one to the emergency room, you may not be able to be with him or her, so you can have that paperwork filled out and you can make sure that the emergency room people understand that this is a person with intellectual or developmental disabilities.
Thank you, Cara. Patty, how are we doing with the chat?
Well, we have a lot of great questions and comments coming, so I'm going to try to do my best to state the questions, and there's a lot of good commentary on people providing answers. One question from Jackie is regarding payment, and she's asking, my adult dependent son has not received payment. Will he, or is this group being left out? And then she also asks and states, my parents are elderly and disabled and still no payment yet.
Is my colleague Brett Williams, I believe he is on the line. Brett, can you unmute, please?
I unmuted.
Will you speak to the adult dependent issue in regards to the payments?
Yes, if there's it was my understanding that if you have an adult dependent, you had to file a form with SSA, Social Security Administration, by yesterday. They announced it, and it was only live, to my understanding, for 6 days from the Social Security Administration. If not, if you hadn't filed the paperwork, you would file it for your 2020 returns and receive it in 2021. I see some shaking their head. Is it an agreement or a disagreement?
That is what Aaron, in fact, reported on the call yesterday.
And from what I've read as well.
And so I guess if you're in disagreement with that, the best thing to do is probably to contact your federal legislator.
As well as double check with the Social Security Administration to make sure it has been waived, because there was quite a voice Capitol Hill, from what I understand, that let people know that this was a very, very short time frame, and that, how are people supposed to really know, what to do in a period of, literally less than a week.
Thank you, Brett.
Certainly.
Patty?
We have another question asking, are there any providers that are looking to get all staff tested for COVID-19? What about new hires?
Could you repeat the question, please?
The question asks, are there any providers that are looking to get all staff tested for COVID-19? And what about new hires?
I can't answer that directly, but what I can say is that under the, I believe it was the second COVID package, possibly the third from the federal government, that there was an exceptional amount of money dedicated for testing and expedient results. I don't know how that's going to funnel down into individual caregivers or how that's going to work. The money's dispersed, guidances will be issued to kind of determine how this money will be utilized for testing.
Thanks, Brett. Patty?
We had a comment from Kelly Rad, and they're saying, I'm concerned for the effects of limited human contact and mental health. This is a main concern for those I service, the developmental disabilities population, and for myself and family. I think we'll see a spike in homelessness, depression, and suicide, which I know we touched on a bit earlier. Yeah, 1 second. I'm going through the chat.
While Patty's going through the chat, I do just want to state again that we might not have all of the answers. We might not be able to answer every question today, but again, we are collecting this information so that we know what information we need to, what resources and information that we need to provide. So if you have a question, don't get frustrated with us if we can't provide the answer today. We will get back to you on it. We are working.
Pedro, we have one question. Lisa, go ahead and ask your question.
Thank you. I work for Network 180 in Grand Rapids, and I just feel the need to say that I feel like from the federal administration, the information that comes out for our individuals is very confusing. It's confusing to us as supports coordinators as well. And then trying to explain it when we don't totally understand it is difficult. The effect that this is having on my individuals is large. A lot of my individuals live in group homes, and now they're confined to their group homes and can't get out. They're having none of their regular supports, whether it be the day programming they attend, the work they attend, and they don't understand as much as I and their other support systems try to explain to them this is a health and safety thing. Many of them don't understand the necessity to stay safe and stay home. I have an individual that I serve as well who is semi-independent, and we still have CLS in to see her daily, but it's been drastically cut. And I'm seeing an uptick in phone calls to myself as well as her other supports. Over the weekend, I even got a phone call at 3:42 in the morning, but she called 3 of us a total of over 50 times. And that's directly largely related to she doesn't have access to her support systems at this time. And it's challenging for those of us who are still trying to provide some support as a social worker / supports coordinator. Our caseloads are still the same. Many of my colleagues are working from home, but we're doing everything from phone calls the best we can. And it's just a challenge because our individuals also can't see us. Many of our individuals can't speak. And that creates its own issues too, because now we don't have interaction with them. So but I think the biggest frustration right now for me is from a confusion standpoint, often from our federal government. And I know that's nothing you guys can do, but I just wanted to say it.
Thank you, Lisa. Patty, anything else you want to read to us from the chat?
Yes, one moment. We did have a comment from Sandra Kernan, and she's asking, is anyone else upset and hurt and maybe scared by the people saying to call the herd, let the weakest die, etc., that the protesters are saying and putting on signs?
Yeah, I don't think that's fair.
And we have another comment. We have another question from Jackie saying, my son requires sedation dentistry and has a loose tooth. He's 25 years old and it's causing him a lot of anxiety and sensory issues. When might these services be allowed again?
Next question. Is there another one?
Yes. Yeah, one second. We had 2 questions from Ashley K. What are some of the greatest concerns you would like employers to start considering regarding people with disabilities and their families? What would successful care and workforce support look like to you?
Those are 2 really good questions that I don't know that we can necessarily answer today, but if Ashley K would put her email in the chat, we can connect her with our employment person at our office to kind of talk through that and look at some of the federal supports some of the supports that are being suggested at the national level on employment supports.
And then Tedra, we have another question from Eileen Brandt. And she says, I've been hearing from some clients that they are having difficulty with their bridge card getting delivery of groceries. With having vulnerable health, have you heard of the bridge card SNAP benefits being able to be utilized for delivery of groceries? I know that delivery services and pickup services for groceries is difficult and available of products is spotty at best. Any suggestions other than going to the senior disability times at stores?
That is a really good question. And we are actually hoping our session, we're working towards having our session next week on accessing food. Because there are some, in our state, there are some retailers that are accepting EBT for grocery pickup, and there's a pilot project going on, and there are different resources available for people for accessing food. And so we are working towards right now putting together the next week's session on that topic.
Tedra, we have a question from Pam. Pam, go ahead.
Hi, thank you very much. I'm from Michigan, and I have a home care company for the last 10 years. My problem is I have a particular client that I've taken care of for, my goodness, 9 years now, and he refuses to get a flu shot, and he refuses to wear a mask. He is wheelchair bound, but when the weather gets nice, he loves to go outside in his wheelchair, in his power chair, and he doesn't respect the distancing with neighbors. And he refuses to wear a mask. And does anybody have this experience, or how can I combat this? Because he's not only affecting the health of himself, but also the health of the caregivers that have been working with him.
I've had that experience with, this is Lisa in Grand Rapids again. I've had that experience with one of my individuals that I serve. And the gist of it is educating, because she still is allowed to make her choices whether I agree with them or not. And all the supports in her life have just had to continue to try and educate as much as they can. And then at times, if it's a health and safety issue, trying to rearrange how and what services are provided so that she's not necessarily getting as much, and the service providers are making sure they're wearing masks, they're doing things, but ultimately it comes down to the individuals are allowed their choice, and even when it affects health and safety, we still, most of the time, cannot force them to do something they don't want to do.
And we do that. We do exercise the caution and safety within the caregivers wearing masks, and trying to get Lysol wipes has been a challenge, I'm sure, with everyone. So I've doing the bleach and water mixture to combat that. But I mean, I have strict rules going into any of the clients' houses. First thing you do is wash your hands. Nobody's allowed in the house. No friends, no family. I'm sorry until this is over. But I appreciate your recommendations, and I know we can't force them. But God, it's like you're trying to keep him safe and alive. He's 65 years old, cerebral palsy, and weak lung issues. So, but I appreciate your comment.
Can we, I want to go to Tracy and see about any comments that we've got on Facebook.
All right, sure. So Elaine had mentioned that she's a director of a large vocational program in Canton, and they're doing drop-off of equipment and activities as people are calling their agency. And they're reaching out to participants to set up Zoom meetings to ensure people still have contact with friends. Tracy had mentioned that they're continuing to have weekly therapy sessions via Zoom and telehealth appointments as needed. And they're also doing Zoom calls and Facebook watch parties to keep people connected. And then Christy had asked if Carolyn, she had mentioned a website. And Carolyn, if you could put that website in the chat box. She said, thank you for sharing that resource. And then the other question we have is from Tracy. And she asked, what are the guidelines for community living support workers? Have someone ready to become a CLS worker, and her daughter really needs support at this time.
Thank you, Trace. I wanted to, Patty, did we get to everything in the chat?
We have one more question from Marissa. And she says, as restrictions in the state loosen, we are concerned about continuing to keep our individuals with high medical needs safe and healthy. While the world starts moving again, we are aware that our precautions and fears will continue. My question is, are others planning for what this will look like for agencies and individuals and restrictions loosen and the staff are more integrated, more into the community?
Also, Jamie, did you have your hand up? Did you want to add something?
Yes, I did. I wanted to speak to the individuals not wearing masks. One of the things that I found, I want to introduce myself. My name is Jamie Jr. I'm a peer mentor, a member of the DD Council, and also help run a disability rights organization in Detroit, Michigan that is helping to respond to the mental health and well-being issues that folks with disabilities are facing. In regards to the mask issue, one thing that I've heard from some of my constituency for not wanting to wear masks is because they cannot breathe in them. So that may be something to consider for the gentleman that won't wear a mask. He may not just be being defiant. He may not be able to breathe. If he has limited control over his throat muscles, he could be, aspirating whatever the mask is, and it chokes him. So that may be one avenue to look into. Additionally, we hope WOW, which is the organization I'm on, Warriors on Wheels for Metro Detroit, we host a 3 times weekly well-being call for folks with disabilities just to decompress, discuss, and gain resources. It's on Meet. I can definitely put the information in the chat for anyone who would like to join. Also, if you live in Detroit and you need groceries delivered with your EBT card, right now we have limited funding and we've developed a program to help folks gain access. We have delivery drivers. So we're launching a pilot right now and looking for additional funds to keep this going. So if you needed any assistance, the turnaround is about 2 days. We do deliveries on Tuesday, Wednesdays, and Thursdays, and we take registration Monday and Friday. I'll be happy to put my email and as well as the Google Chat information in the chat box. Additionally, if folks need support, I am available. So if you send me a message, we can Google Chat, even if it's just to see someone else's face.
Thank you, Jamie. And if you would put all of those resources in the chat, we would greatly appreciate it. We are going to, from today's conversation, we're taking down all the questions, all the comments, what the issues are, and we're going to develop an FAQ that's going to go out to everyone, go out to people participating. So if you give us your resources, then it will become a part of the record. Laura Demuse from MDHHS Behavioral Health, I think had an answer, Patty, to the person on the Facebook comment about getting CLS, how to get a CLS worker. But it's been a lot of chatter since then. And so if we could read that question, if you could find Laura's response, Tracy can take it down and type it in the chat in Facebook for the person that's watching.
Sure, I think this is from Laura Demuse?
Demuse, yes.
Yes. She says CLS workers have already had training requirements loosened and background checks waived during this crisis. This is so people can get CLS working faster than usual.
Okay. Thank you, Laura.
We have another question from Noah Walker. And he's asking, how is the DD Council confronting Medicare rationing? We have been in the front lines along with NDRN trying to fight these issues with the federal government.
We have the council, along with several disability partners in the state, have been we've sent letters to the governor and other officials about medical rationing. And so I think that we are all trying to battle that and helping to make sure that that does not become a reality, or that, you know, too many people aren't affected by it. I'm gonna ask Brett to unmute again and see if there's been any, if we've got any response.
Yes, I have not personally received a response. We have sent out a voter voice, which is our advocacy tool that addresses immediate stop to healthcare rationing for people with disabilities and to establish federal guidelines. As Tedra shared, the council is working with several groups that are working very diligently to ensure that healthcare rationing does not take place, and that all people with disabilities have equal and equitable access to healthcare throughout the COVID pandemic problems that we have in front of us. So there's a lot of things going on right now. We are also in the throes of having one more letter sent out. So we have really been up front and out in front of this and really try to bring it to people's attention that this is a very unacceptable practice. Health and Human Services, also Office of Recipient Rights, have released I think it was March 28th, had released a document that supports the position that people with disabilities should not experience any healthcare rationing. And we're basing a lot of our positioning around that federal guidance. And there's other people who I've been working with on this as well. Jan, did I leave anything out?
I can't unmute myself very quickly.
Oh, sorry.
I'm old and slow, so I can't get the unmute. There is the same group that Brett's talking about that's writing one last letter to our public policy officials, is also going to be hosting a webinar on Tuesday. I think it's going to be at 9 a.m. We'll get invitations out to everybody. Tedra will be getting that to you to send out to everyone. But that's for people to help them understand what their rights are and understand some tools or some strategies for advocating when you're standing there in the emergency room, possibly not getting the testing that you need or the treatment that you need. So, some of the work has to be big, broad public policy advocacy, and some of it has to be while you're standing in the emergency room to get what you need, right? And so we're going to try to give you some tools, everyone who wants to hear them, some tools and some strategies for making sure you get the treatment that you are entitled to.
And I'd like to add just one other thing, is that we've been working with one of the leading legal advocates for people with disabilities in healthcare on setting our positions and setting the terminology and the words used within these letters. So we're very confident that we are doing as much as possible to ensure that the people who would regulate this know our position and is backed by the authority.
Thank you, Brett and Jan. Any more questions or comments in the chat, Patty or Tracy from the Facebook?
We have a question from Carolyn. She says, if a person is experiencing healthcare rationing due to having a disability and having Medicaid, who should they contact to assist them if RR, MPAS, and others are not responding?
That is an excellent question. If recipient rights and impasse aren't responding, is there anyone on the line that has an answer that can answer that question? Otherwise, we will have to track it down and get back. Oh, Laura Demuse says call the news.
Jamie, again, I would also say reach out to your city's civil rights department. They may be able to help you. We've had a lot of success with that in Detroit.
Thank you, Jamie. Has anyone experienced a slower response from their caseworker or supports coordinators during the pandemic?
No, we haven't. We've been doing Zoom for everything, work and everything.
But the one, hold on.
Thank you.
The one thing I like is I'm a huge fan of Supernatural, so their conventions and stuff, they're doing them online, so we get to interact with the actors and stuff, and they're doing more live Instagrams just to have your heroes, like, personal touch, just people you look up to. That's one good thing about this.
That's been helping you?
Mm-hmm.
Thank you.
This is Elizabeth in Kalamazoo, just to kind of talk on the delayed response from the support coordinators. I am a support coordinator in Kalamazoo, and I know for a lot of my coworkers and myself personally, this is also a very different time for us, not being in our office, working on a cell phone versus that. I would definitely encourage, if you feel like you're not being supported by your case manager, to reach out to their supervisor, reach out in any other way that you have if you're not getting that support from them. Because me personally, I know I have a little one here with me, so there are times where I'm not going to be able to get to my phone right at, how I normally would. But if you feel like you're not having that support, reach out to whoever else you know that you can. Have staff reach out to somebody else, have family, because I would really hate to, know that somebody doesn't feel like they're being supported. That was just my 2 cents.
Thank you, Elizabeth.
Also, to add to that, I know that our local CMH for Washtenaw County, I know that how they are responding to this crisis is they are staggering their supports, and so our supports coordination is still happening, but it's looking a little bit different. And so the response time is still there, but how they're delivering those supports is definitely presented in a different way, and they're really working at staggering their team and still delivering those essential services.
Thank you, Anna.
Yeah.
Patty, it looks like we've got some more chat. I don't know if they're questions or if it's just comments.
We have a lot of comments. We have a lot of people helping each other, which is great. Tracy, I see you posted a Facebook message. Do you want me to read that one? Yes? Okay. This is from Facebook. And Tracy Keating says, my daughter had surgery in the past, and I stayed with her until she was discharged from the hospital. It scares me to think about her requiring medical care and me not being there to help advocate for her and reassure her.
Thank you. I do know, I think it's on a case-by-case basis, but some hospitals are allowing, depending on what it is, they are allowing you to have a person if it's a life, life and death situation. But I think it definitely does depend on the hospital and the staff at the hospital.
This is Eileen Brandt. I just wanted to say, I appreciate that, Tedra, but I think it's because there's no listing. Like you can't say, well, we'll make sure that they go to this hospital. And, you don't know about staff, whether it's going to be different or not. We're hearing from our clients the same type of issue. It's just the concern of if they have to go in there, they aren't going to be able to they may not be able to advocate for themselves as much as the family could advocate. So it is a huge concern on parents' minds.
So one of the forms, I can't remember who put it in. Someone put a form in the chat, and we'll make sure that we definitely send it out. It is a form that you complete that has a lot of information. That if your family member with DD has to go to the hospital and you're not able to go with them, it's a form that you complete a lot of information on them for them to take with them to the hospital, so the hospital would have that information. I did reach out to a colleague that works for the Michigan Hospital Association to see if Michigan hospitals would accept and honor that. I've not heard back yet. And so hopefully within the next couple days to a week, we'll be able to really distribute that widely. It's not anywhere close to being the same as someone, being there with you, but it does, assure that people can take their wishes with them, especially people that aren't able to speak for themselves. Any other questions, comments, anything else that people want us to share? I would like to also ask if there's other topics that you want us to cover, that you would like to see resources or find us to identify speakers that can speak on certain topics.
Food stamps benefits.
Food stamp benefits?
Yes, I was receiving before this pandemic happened. I was receiving $16. They never told me why I was receiving that every month. And I live with two other roommates, and the $192, Laura, that I was getting, $194 was coming in the house for, food that we needed. So it wasn't just me eating them, it was the house eating them too. Well, they cut me down, and we were wondering, why did you cut me down? We never had nothing. We didn't even have a hearing or nothing. So now, since the pandemic happened, we're receiving them into June, which I'm thankful. But it's when June comes, it's you're just going to receive $16. What is $16 going to do for 3 people that live in a house?
You definitely want to reach out to your case manager at DHHS for that and ask those questions.
Okay. Thank you.
Brett, Mr. Williams.
Yes.
I wanted to just say to know if you could touch a bit. I know we just were able to see the K waiver in the last couple days, but if there was any information in the K waiver that's applicable to any of the questions or concerns that people have brought, is there any of this being addressed in that waiver?
Yes.
Submitted to CMS?
Yes, but as far as all the particulars, that what's going to have to be explored a little bit more. Some of the things about meals and things like that are addressed in the K waiver, but we also, this is going to be a process because there's other waivers we can apply for, like an 1115 demonstration waiver, that we can use the K waiver to open the door for the 1115 waiver. And then I'm not going to get all the numbers, but basically it's going to be a process But part of the areas addressed is food delivery. Some of the other things is personal protective equipment for not only the care workers, and one of the questions I have is for the beneficiaries as well. I would hope that would be the case. So some of the things that have been asked today are addressed, but I am in the process of researching exactly how that's going to play out.
So I think what we'll do, I know that, we were just able to see the application in the last couple days. And so I think over the next couple weeks, we will definitely hold one of our sessions on the waiver and hopefully get someone from behavioral health to come on and speak to the specifics that are in the waiver. It is just an application at this point. It has not been approved. And so I do want to just let people know that while CMS, Center for Medicaid and Medicare in DC, has been rapidly approving them, ours for Michigan was recently submitted and it's not, it hasn't been approved as yet.
If I may add, CMS, as Tedder said, have been approving these fairly quickly.
Any other questions, comments, concerns?
I do have one question through Facebook. And Alicia had asked, direct care workers are not considered essential workers. Why is that?
Why aren't direct service professionals considered essential?
They are. I'm sorry, this is Angela.
They are
considered
yeah.
direct because they're healthcare. They fall under the healthcare category, and the governor was really clear about that from the beginning. Direct care workers are essential workers. That's why they can continue to go and provide supports.
Thank you, Angela. Patty, any more questions or comments in the chat?
No more questions.
Tedrick,
we have a lot of great comments, though.
Tedrick, can I add to that last comment? So, direct care workers are essential workers, as that individual stated. I found, from a consumer standpoint and a supports person for people with disabilities, the one thing that is really helpful for protecting access to those supports at this time is having a letter that states that that particular staff person is providing that essential service, so that if they are stopped by the police or something of that nature, they have that documentation that says that they are providing that essential work.
Thank you, Anna.
Yeah.
Petra, we have another question from Carolyn. She asked, does anyone know why the overnight supervision and safety hours have not become available to individuals on the habilitation supports waiver, even though approved by CMS as of October 1st, 2020?
Oh.
I would ask Laura Demuse if she knows the answer to that question. If not, we will work with behavioral health and get a response for Carolyn.
Can you guys hear me?
Yes, Laura.
We can hear you, Laura.
Okay. My only thought is that because it's such a new service, a lot of CMHs are struggling trying to figure out how to implement it and when it's appropriate and when it's not appropriate. So it shouldn't be that it's not available or you can't use it. It's just that a lot of CMHs are kind of trying to make sure they're dotting all their I's and crossing all their T's correctly. And unfortunately, it's kind of causing a delay for some people.
Thank you.
This is Yasmina. Laura, has the department put out any guidance for CMHs to make this process easier for them? Because if they're so reticent, I mean, at the bottom line then is that it's not available. So it might be more helpful if there's some guidance that could make it more available.
There is fact sheets, and there's a regular Gov delivery that goes out to the PHPs and CMHs that usually includes information about it. It's just still a lot of people have a lot of questions that aren't clearly answered at this time, I think. And that was kind of one of the things that we knew when this service was designed, is that we were going to kind of have to put it out there and see how it went, and then be able to kind of make adjustments as we go along. So we really need people to kind of jump in and start using it before we can kind of tighten up some of the loose ends that we have right now, because the design between CLS work and the overnight health and safety are very similar in some aspects, and a lot of people have already been using CLS for overnight work. And so that's where the confusion lies, is when are we okay to use CLS and when should we be using this overnight health and safety? And we think that at the department there's a clear delineation, but I think there's just a lot of confusion because it has always been okay to use that CLS before. So it's just trying to figure out, okay, well, when do we switch from the overnight health and safety to the CLS at this point?
Thank you, Laura. Patty, it looks like we've got a couple questions in the chat.
Yes. We had a good comment from Eileen, just saying on the school side, there's a definite disparity of services in connecting with students and families. This is a definite concern. Requesting compensatory ed is going to be a very large aspect of advocacy in the coming months. And then we have a question from Facebook from Abby, and she asks, is there talk about hazard pay for CLS workers?
Brett, has there been any talk about hazard pay for CLS workers?
Yeah, I had to mute my phone. Excuse me. And in the Appendix K waiver, there is, and I have a question in the department to get that answered.
Tedra, this is Sharon.
Sorry.
Our office, Aging and Adult Services, our director has been advocating for hazard pay for direct care workers that work with anyone throughout the state. So there is some discussion at the managerial level, MDHHS, to provide hazard pay for direct care workers. Right now it's just in the discussion stages, but they're well aware of it and they're working on it through the state, the managers at the state.
Thank you, Sherry.
The Washtenaw County CMH directors are also advocating for CLS supports to be falling under hazardous pay, but there's more work to be done in that department. But the conversation has started. Just to share that.
Thank you, Anna.
Yep.
Any other questions or comments in the chat or on Facebook? Seeing none, do we have anybody else want to share your experience, share how the COVID crisis is impacting you? Do you have any questions or comments?
I have a comment. This is Jamie again. So this is one thing that I would like to say to all the people on the call. I'm an advocate. I do a lot of work around the state, and I'm still having trouble dealing with this. Dealing with the distancing, not being able to see friends and families. My mom was in the hospital and I couldn't go visit her, and there were a lot of things going on. And the only reason why I share that is to say, no matter, I say that to say be kind to yourself, because no matter how much you know, something like this is hard. So be kind to yourself and don't be afraid or ashamed to reach out to someone for help.
Thank you, Jamie. I think, taking care of yourself is really important at this time, given, for us all to give ourselves grace and just be kind and gentle and reach out if we know we need help is really important in this time. I also want to add with everyone, with all of these concerns that we're bringing up today or that are being brought up today, that people should definitely be reaching out to their state and federal legislators and let them know about your concerns. We do know that at MDDC, the disability advocates are doing advocacy for specific disability resources and specific disability asks and issues for the next package, if there's another round of funding, to be able to work directly on disability issues. And so if your legislators hear from you and they hear these stories and they hear how you're being impacted and what you're experiencing, they will be more likely to pass a stimulus package that directly relates to disability concerns. And so we definitely should be reaching out to state and local legislators about your specific concerns. Anybody else in the chat, Patty?
Not at this time, just some really good comments still, which we'll have a record of this as well.
Great.
Also, some really good resources have been shared, so we'll want to make sure that we're able to get this out to the group.
Robert Spruce says he will let his voice be heard. Thank you, Robert. He's the last person that commented. I can see that. There was someone in the chat. I just saw group homes come through, but it's so many comments I can't see. Someone provided a question or a comment about people being stuck in group homes.
That was me. I just said, I sent a letter from behavioral health about freedom of movement and visits in group homes and nursing homes. So basically the letter talks about just because we have this stay-at-home, stay-in-place order does not mean that you have to keep people at home. It talks about hiking and walking as long as you're maintaining the 6 feet distance, figuring out a person-centered way to help people, not be huddled up at home. So that's all.
Thank you. Laura, are there also resources from the department on group home safety and what to do if someone in the home is ill or someone in the home or one of the workers is ill? Has anything been put out by the department on those issues?
Yeah, there's a bunch of different guidances on not only the overall MDHHS state website, but behavioral health has their own COVID-19 page that has a lot of resources. And I can put that in the chat if you'd like.
Could you email that information? This is Lauren Glover from the Arc Detroit.
I'll put
Hi,
it in the
Lauren.
chat.
Okay.
Yes, Laura, if you put it in the chat, we'll make sure that it gets distributed widely.
Okay, good.
Comment or question?
Well, what we're doing, we're getting PPE to the group home staff and people, residents, because we had a couple of group homes had a hard time. All the people were tested positive in the group home, a couple of deaths. So it's really, really important for the staff and the residents get PPE. We talk about the nursing home aides and the hospital aides, but direct care workers are healthcare workers too, and they should get the same amount, the N95 mask, because they're dealing with people, taking care of people that may be COVID-19 or recovering from COVID-19 or whatever. So they need that same amount of equipment. So what we've been doing, we've been delivering food and PPE equipment to group homes, to our people with IDD that live with their relatives and so forth. So I think that's a big issue because we've experienced a few deaths, people dying from COVID. And people are making makeshift masks. If you have someone in the home with COVID, you need a mask with N95 mask.
So the Arc Detroit is providing N95 masks for group home staff.
Well, we're trying to get them. I can't. I got hundreds on order right now. We delivered 100, and I'm trying to get them. There's one group that I'm working with. They sell them for $7 each. There's another group that sells them for $4 each. But I don't have the money to, because we're paying out of our pocket for these masks, and we get them donated. One state rep, Tyrone Carter, donated some. I'm trying to get some from Sylvia Santana and Karen Wissett. So that's what we're doing, right? Donating, or we're getting the PPE equipment for the staff and the residents, the ones in the group homes and ones living on their own.
Thank you, Lauren.
Oh, okay.
Are people having trouble accessing telemedicine? You're able to have a doctor's appointment online or via Zoom or via phone, and that was expanded in Medicaid. How is that going for folks?
This is Lisa in Grand Rapids again. In speaking with a couple of the group homes that I support, they don't have the technology in their homes. They don't have a computer or a smartphone to be able to access Zoom or Skype. They do try to do some through phone calls, but it is much more challenging for the individuals to get those appointments. And then when they do phone calls, there aren't nearly as many people involved in the appointments. It's often just like with a psychiatrist, the psychiatrist and the individual. The psychiatrist then doesn't call the supports coordinator or the guardian or other people involved in the individual's care to find out from us our input. So it is definitely affecting the individuals because not full input is received at those appointments.
Thank you. Anyone else working with people that are having issues accessing telemedicine or telehealth? Okay. We are scheduled to go till 1 o'clock. However, if there are any more questions or comments, I think it would be okay for us to sign off. So I want to ask again, just make sure that everyone that's on the call had a chance to express themselves, express their concerns, let us know what you're experiencing or how you're being impacted. Marissa asked a question.
Yes. So Marissa's asking, are you planning a follow-up meeting about how guardians and consumers will hear about it?
Yes, Marissa, we plan to hold a weekly session, and so all of our partners are sending it out. We put it on our Facebook, the council's Facebook page. So if you follow the council's Facebook, or like our page rather, like the council's Facebook page, you can be notified of when the next meetings are. Our next one will be next Thursday at 11, and the topic will be on accessing food and groceries, or accessing food so that people are able to get groceries. And if you would like, we also send it out to the council's, our listserv. And if you would like it directly, I will, if you put your email in the chat, anyone who puts their email in the chat can get the notice directly through the council listserv.
Tedra, we had a question about the Zoom link. Will the Zoom link be the same for each Thursday at 11 a.m. meeting?
It will not. Zoom is recommending that for safety and security to use the random Zoom numbers, use the random meeting room links. And so we are not going to have the same link every week. I see we're getting a lot of emails in the chat. Any more questions or comments on Facebook, Trace? Well, thank you to everyone for joining us. We really appreciate it. And we will talk with you all next week.